Recently, the Centers for Disease Control and Prevention and the National Center for Health Statistics announced 100,000 people died of fentanyl overdoses between April 2020 and April 2021. In just 12 months. This marks the first time drug-related deaths have reached six figures in any 12-month period. It's a number too big and too devastating to have escaped the attention of Assemblyman James Ramos. He joins me now live to explain two bills he's authored to help attack the addictive threat of fentanyl in new ways. Good morning to you.
Good morning. Thank you for having me.
Well, thank you for being here. Narcan, the name brand for naloxone, has been a tool that ambulance crews have had for a while. With AB 1627, you're wanting to expand the accessibility through funding from the State Department of Public Health that would make getting this particular treatment and being trained to use it for free. Now, who do you think would go in for such trainings, and how much do you think this could help in the fight to save lives?
So this is definitely a proactive approach, making sure that we're getting resources in front of the loved ones and those that are partaking in this type of activity to make sure they have Narcan ready, available for them, so they would get some training from Department of Public Health and with law enforcement so that they would be able to have Narcan ready when the situation arises. And it comes from working with families that have loved ones that have overdosed, but also families that had Narcan readily available to administer to those that were ODing on fentanyl, that they ended up bringing those individuals and saving their lives.
AB 1627 would also create more funding for law enforcement agencies to investigate opioid-related deaths. Fentanyl is an opioid. Have you found that departments are not investigating all of the deaths in front of them that may be tied to this epidemic?
I think what we need to do is get away from the stigma that those that are partaking in these types of drugs, illegal drugs, that somehow that's the life that they chose. But when we see that drug users and drug people are panhandling drugs that could cause overdoses, that there has to be held accountability. And so working in San Bernardino County with the Sheriff's Department and making sure that they were able to secure scenes and have narcotics officers respond to overdose on a pilot program that showed results, shows that there's also the opportunity to collect the evidence that you could try individuals for a homicide. So we have to start to tackle the issue by making sure that resources are available, but also working with our law enforcement agencies to make sure that they're securing the scene within that 24-hour period to collect evidence so that you can move forward with prosecution.
Okay, I understand. The other bill you've authored in this space is AB 1628, and it would hold social media platforms more accountable for monitoring illegal activity involving distribution of fentanyl on their platforms. You would also require them to have a policy statement explicitly prohibiting use of their platform to illegally distribute controlled substances and make that prohibition conspicuous on their sites. Is there a lot of distribution happening just in plain sight on social media?
There definitely is. In researching this and working with the families that came forward of those that lost loved ones, in particular, they mentioned the social media Snapchat as a way that their loved one actually purchased fentanyl over the internet, over the social media platform, that then was delivered to their home where the individual OD'd. So there is activity going on. And our bill would start to hold accountable those policies the social media platforms have to make sure that illegal drugs are not being sold through their social media platforms. It's time that we start to hold accountable what's being sold over social media.
All righty, we're going to have to put a pin in it there, but we thank you for coming in to explain how you're working on this. And of course, these two things are things that happen after the overdose or tied to the overdose, as opposed to just really stopping the flow of the drugs to begin with. The social media bill kind of gets at that with stopping the sales, but we've got to stop the flow, right?
That's right. Definitely. There's different arsenals in how to attack the this that's going on with fentanyl and the overdose, and you said the statistics, and we see the overdoses happening. So it's going to take a full arsenal of bills to combat this.
All righty, we'll be checking back in with you as these move through the Capitol. We appreciate your time this morning.
Thank you so much.